and welcome to Career Conversations, brought to you by the Monash Health Science Society. My name is Shivangi.
My name's Sam.
And we will be your co-host for today's session. Through this podcast, we will be exploring different careers in health. Today, we are joined by the wonderful Mariam, who graduated from a Bachelor of Public Health Science at Monash University and is now just months away from completing her Master's in Occupational Therapy. So I will love to ask Mariam, tell us a bit more about yourself and what you do.
Thank you. Thanks a lot for that. So I've, as you said, completed my Bachelor in Public Health Science in 2018. So that was 2 years ago now. Now I'm doing my Master's in Occupational Therapy. I'm literally 2 months away, which is great. It feels like yesterday I just graduated. And yeah, in terms of, I guess, what I get up to, maybe not much. I'm a bit boring, I think. But yeah, I love, I guess the general things like reading and that kind of thing. So I keep really busy with that, especially considering this lockdown right now.
Perfect. That was my next question about your hobby, which you've already specified. So we go to the next one. How did you become interested in the field of occupational therapy or public health?
Well, my journey is a bit funny. Actually, I don't think it is. I think it's very similar to a lot of us. I knew I was interested in the health field, but didn't know where to go straight out from uni. The Bachelor of Public Health, it was more so, I think it was a good place to start. Initially I was like, I'm not sure what public health really is. But, as you go through it, you kind of figure it out slowly. And, and I think after the first year, I genuinely fell in love with it. There were so many areas that you can go to. There were so many different opportunities. And that's where I ended up in my, doing my Master's in Occupational Therapy. And I chose that simply because I felt like there was a lot of elements that were similar. So the principles of Masters of OT and Public Health, it was a lot about, taking the holistic approach and considering your environmental factors. So they were really similar in the sense, and I felt like they meshed very well. And I guess I really enjoyed, I enjoyed both of them. So that's a bit about my journey. Perfect. And how I got into it.
That's very exciting.
Yeah, it's been great.
Yeah.
Thanks for that. Just, I guess, a different question, but in case anyone doesn't know, what exactly is occupational therapy and what does it entail? Okay, so I'm still trying to figure out how to answer that question. It's like asking what's public health. It's kind of funny. Occupational therapy has multiple streams. So, you could be working in areas of mental health. You could be working with children, aged care. There's also an area specific to hand therapy, which a lot of OTs can actually get into. I like to describe occupational therapy by defining occupation. So occupation isn't only work, but it's also your self-care activities and your hobbies. So our role is to basically intervene if you're having trouble with in completing any of these roles. So that could be, modifying the environment, prescribing assistive technology that might help you, and that kind of thing. So you're not so much fixing the person, but you're fixing the environment for them, just to make it more livable and improve their quality of life. And it's not so much fixing the person, but actually fixing the environment, which is amazing. You get super creative, and a lot of people do and change things in crazy ways. But yeah, it's super, super interesting. Yeah, that sounds really cool. I guess a career where, you're not just treating the person, but you're treating, like you said, their environment and improving, not just physical health, because sometimes, some things can't be fixed or they're a little bit longer, but, improving quality of life is really important too. What's the favorite part of, I guess, your course so far?
or what do you like about actually studying it?
I guess maybe the goal. So when you do see patients and clients and that kind of thing, the goal you're working towards is making their life better or improving that quality of life. And just, I guess that goal is, it's just so meaningful. You know, you're not just fixing it and then letting it go. It's almost like a journey. I think the essence of OT is what I love a lot. You know, a lot of people kind of been asking me now, you know, what area are you into? What stream are you into? Like, what are you interested in? And I just feel like the goal or the role of OT doesn't necessarily change across the streams. So no matter where where I kind of end up is, I'm kind of interested because my role is the same. You know what I mean? So I think it's the actual essence of the I was going to say the degree of the degree. Yeah, it's the essence and the principles of the degree that I guess I enjoy most.
Yeah, wow, that's really cool. And as part of your course, I guess, have you got the chance to do any placements or practical units? And if so, can you tell us a little bit about, I guess, what you did on them?
In my master's?
Master's or public health, both. Yeah.
Okay, well, with the public health, I didn't actually do placement, and I kind of kick myself about it now because it would have been nice. Experience is always great to kind of reflect on and use that to I guess progress. So if anybody wants to actually do placement or still has the opportunity to do placement, definitely do it. But yeah, in my Masters of OT, we're expected to complete 1,000 hours of placement over the 2 years, which seems like a lot, but now that I'm almost finished, it feels like it hasn't been that much. I've had 2 placements so far, one in a hospital and one in hand therapy, which were both very interesting and very, very, not so much different, but you just learn so much. You learn so much, and no matter how much you attend the classes, like the theory is great, but putting it all into practice is like, oh, this is great. This is actually what I want to do, you know. So yeah, they've definitely been interesting. I've in my last placement in the hand therapy department, I had my own caseload, which was really fun. I was like, oh my God, you guys are really going to treat me like an adult now? I'm not ready for this, you know? So yeah, it's been interesting. It's been fun, and I've just learned so much. So yeah, it definitely prepares you for graduation, but I feel like by the end of this year, I still would feel like I have all this knowledge, but don't know how to use it. But there's so many jobs that take that into consideration. You know, your graduate programs that they're going to teach you absolutely everything. And no matter where you end up, like at a new job, you always feel like you don't know anything, or you don't know, you know, it's just a new journey. So no matter where you end up, you're just going to need a bit of time to get used to the work and all that. It's not that you don't know anything, it's just, you know, you need time to put it into practice and get comfortable with the new environment.
Yeah, of course. That's a really good point. And what would you say are the most, I guess, important skills for working as a OT? Obviously, you're not quite there yet, but like from your placements and things like that, what skills would you say are the most important?
I think active listening. You need to be able to genuinely listen to your clients and hear about them and their stories in order to be able to do your role adequately, I should say. And also just empathy. You know, being in the health field, like you come across so many people who've got it tough or had it tough or going through certain things or experiencing certain things. And you need to be able to empathize with them and, you know, not just go to work as like, it's not your corporate job, you know, you kind of take your heart with you and take your heart out. No offense to any corporate people. Sorry, guys. But Yeah, definitely. So active listening and empathy, I think, are two really big skills that you need to have and slowly develop. But yeah.
Yeah. And in regards to, I guess, what you're doing at the moment as a student, what does a typical day or week look like for you as a master's student?
Well, there's a lot of working on your own. So you'll probably get about 2 to 4 classes a week. And they could range from like 2 hours to 4 hours. There was one day that we had an 8-hour class. Like, yeah, that was definitely long. I did not leave early. I didn't. Yeah, so 2 to 4 classes, about from 2 to 8 hours, depending on what you're doing and what area you're studying. And then a lot of it is your own work. And all your assignments are very, very, I guess, not so theory based. They're very practical. So you'll get this pretend client. Now, what are you going to do? So you use everything you learn in that course or in that subject, and then implement that into like a plan to show, I guess, the tutors what it is you're going to do, and are you safe to move on, I guess. So it's very practical, which is really interesting, but there's a lot of readings, which I feel like is always the case, but I feel like there was more readings in my master's than there was in my bachelor's. I genuinely enjoyed my my bachelor readings. I think that was so interesting, and I've kept like half of them, which is a lot of readings. But
Wow.
yeah, I just really, really enjoyed reading them. But yeah, so there's a lot of readings. There's a lot of self-directed learning. No one's gonna obviously follow you up and stuff, but it's great because it's pretty serious. Yeah.
Awesome. And I guess living in a season of coronavirus and a pandemic, we're aware that lots of things, I guess, in our industries are changing. But do you know like anything about the impacts of COVID on the occupational therapy sector, or like what the future looks like for OT?
I feel like the future of health in general is might, I guess, move towards your telehealth. So a lot of appointments will be conducted online, if appropriate. And I guess the virus kind of gave everybody that push to technology, something that's kind of been in the air and discussing, like, why don't we do online appointments? And this went, I guess the virus kind of pushed it from an idea to actually implementing it. So I think it'll definitely move to a lot of telehealth appointments, all your online appointments, especially because a lot of them would be catch-ups or like reassessment and that kind of thing. So, I hope it doesn't change much for OT, because as OTs we do a lot of home visits, obviously, because the environment is important. So I hope there's still that, patient contact. But yeah, it's interesting to see what else changes in the next few months as well.
Yeah, definitely. And what is your current advice for current public health or health science students?
The public health or the public and the health science field is really interesting because it genuinely leaves you with so many opportunities. Like, I remember doing, I loved the epidemiology subjects and I loved the biostats subjects, to the point where I was like, maybe I want to do a master in, one of those. I can't express how much opportunity you have. And I'm just one of those that's like, I want to do everything, but I can't. So I definitely think that look at all your options. Do some research. Like, you'll end up finding things that you're like, oh, we can do this. Definitely ask your tutors a lot of questions. I feel like because I knew I wanted to do further study, I didn't take advantage of that in my last month or so. what are the job titles that you're able to apply for. Like I feel like I kind of graduated with going, okay, but what's my title? Like, what am I able to apply for? Like, I don't know where I fit. So yeah, just definitely do a lot of research. There's so much information on the internet. Like, I've been doing recent job searches, obviously, because I'm coming to end of grad, and I've just found that I've found so many public health based jobs that I could have applied for 2 years ago. I'm like, I'm qualified for this. Why wouldn't I apply? But obviously I didn't know. So yeah, definitely do the research, ask the questions, keep your options open. There's so many areas of work that apply to the health science degrees. So yeah, definitely keep your options open.
Awesome. And if someone was interested in, I guess, doing what you're doing and doing a Masters of OT after public health, what would be your advice for them?
I think definitely identify the link between public health and OT, because I feel like a lot of my practice, or the way I did my assignments, or the way I thought as well, stemmed a lot from my undergrad. And because they link so beautifully together, it was great. I felt like I definitely had this advantage, to the way I am, and the way I'd be able to practice. So definitely focus on the link between those two, and don't think of it as a separate degree. Think of what the skills you're able to bring from your public health degree, because there's a lot, and just the thought process. I can't express enough how important your quality of life, your holistic approach, the primary, secondary and tertiary levels of prevention, like they're all very, very relevant to OT.
Yeah, great. And just one last question from me, but have you worked while you've studied, or volunteered or anything like that? And if so, what have you done and how have you managed your time?
So yeah, I have worked. I've been working for the past, I think, 3 to 4 years now at Coles, so nothing health related. But I'm also a support worker for Higher Up, which I think everybody doing a health degree could do it, or anyone. So definitely look at that. It's called Higher Up. So I've been doing some support work, and then I think it was in 2018 where I volunteered for Cancer Council for the year. I was a community liaison officer, and that was really interesting. I learned so much just about Excel, really, and just the role of Cancer Council in our community, and the amount of effort they put in to organising events and raising money and raising funds for cancer research. So that was great. And then as of recent, well, not recently, but around mid last year, I signed up for St. John Ambulance Victoria as a first aid officer. That's basically where you get trained to be a first aider, you attend events, and you deliver first aid if need be. So there's a lot of like festivals, a lot of footy games, soccer games. It could be like children events, whether it be like Christmas parties and that kind of thing. So I did that, but obviously with COVID didn't help at all, because obviously all events have been cancelled. So I haven't done any St. John work in the past 10 months really. And yes, so they're the things that I get up to. And how do I manage my time? To be honest, I always think ahead. So I'll always obviously put my studies first as much as I can. But I guess the thing that people ignore is that sometimes you kind of do put your studies on the back burner, because, work is important. You kind of have to go to work. And then you volunteering and giving back is always part of, it's just been part of what I like to do. But if need be, I'm an early bird, so if I'd get up at 6 o'clock and, your day turns from like 7 hours to 10 hours or 12 hours, but in the real world where obviously you have a lot going on, you kind of have to learn how to prioritize. So for example, if I've had a really, really long week at uni, I would cancel that day that I spend at Cairns Council. At the end of the day, you kind of have to put things first where need be. So prioritize, get a good sleep, wake up early, and you're literally able to fit so much into one day. And I think also getting out early, like at 8 a.m. or 9 a.m. or whatever, just leaving the house kind of helps, because if you stay at home all day, you kind of just feel like, I don't want to do anything. Get out and that kind of thing.
I'm curious to know more about your the position you just mentioned at the Cancer Council, the Community Liaison Officer. Mm-hmm. I was just wondering, how did you volunteer for that position, or like how did you get in?
So I found it on their website. They have like a list of volunteer opportunities, and I filled it out. I applied for it, and they were like, great. I did have like an interview and stuff. It was a bit extra. It's like, I really want to help you out and volunteer, and you're asking me for an interview, so it's really not one of those, your standard volunteer events where anybody's willing to take you on. They want to be able to interview you and that kind of thing. So yeah, that's all available on their website. And in saying that, with like at my time there, I was on my lunch break, and I saw one of these girls from uni, from my public health degree. She's like, yeah, I work here. And I was like, see, like we have the same degree. Why didn't I do that? So like I said before, I literally wasn't aware of the opportunities that were available at all. So Cancer Council website, there's a lot of things that are relevant to health students.
Perfect. Thank you so much. That's very good information for our current students and maybe graduates.
Yeah, no worries at all.
Thank you for that, Mariam. Is there anything else you'd like to add? Any job seeking tips or anything like that?
I think there was one more component about applying for jobs. So if anybody's actually ready to go into the workforce, I remember sending an application to the wrong company. So I said, dear, relevant organization, whatever, and I sent it to the wrong place. That's really embarrassing. Do not do that. And definitely, I think when it comes to like doing your resumes and your cover letters, spend a good, I reckon, like half an hour on their website. Look at their values, look at all their information, look at their Instagram page if they have one, their Facebook, their LinkedIn, do a bit of sneaky researching into the workers there, get a good vibe of the place. Because I genuinely just feel like if you resonate closely with the company values and with the people that work there as well, it's not so hard to actually, you're not so much asking for the job, but you're showing them that it's a perfect fit for you, and which is like a lot of what companies actually want. So I think definitely do a lot of research, and everything needs to be personalized. So cover letters, CVs. I know probably everybody's heard this a whole lot about, making sure that you don't have a general CV or resume, and it being specific. Like it's really, really important. Like they want to know that this was just for me. Don't necessarily start from scratch, but changing up certain words or changing up your goal, realizing that certain things aren't actually relevant for this specific job, even though it's really great about you and you want to include it. If it's not relevant, take it out. And yeah, be very specific and do your research. Do your research. I feel like that's the main motto of this podcast. Do your research, guys.
Perfect. Thank you so much for highlighting. I think it's a very important factor.
Yeah, I think so too.
Thank you. Well, I think that's all we've got time for today. But thank you, Mariam, so much for joining us and sharing, a little bit about your journey and some wise words with us. Thank you so much.
No worries a lot. Thanks a lot for having me, guys.
Anytime. And thanks everyone for listening to our podcast. I hope you have a wonderful day. Stay tuned and join us next time for more career conversations.